This video presentation is intended for informational purposes only. So always seek the guidance of your physician or qualified medical practitioner with any questions you may have regarding your healthcare or medical condition. Hi, and welcome to our first episode of Carla Valentine, Nurse 411, also known as CVN 411. I'm Carla Valentine, and as a veteran registered nurse with over 40 years' experience, I understand the stress and anxiety that can come with seeking healthcare guidance. So I'll be here to give you the 411 on some of the most essential healthcare topics and gently guide you through the complexities of home care to help make it as smooth and stress-free as possible. Today, on our very first episode of CVN 411, we'll get things started with a part one of a three-part series, How to Survive Your First Home Care Visit. In today's video, we're going to cover what every patient should know to prepare for their first home care visit. Whether it's your first time receiving care at home or you're just looking for some helpful tips, I've got you covered. I'll walk you through what to expect, how to prepare, and answer common questions to make the experience smooth and stress-free. Let's get started. Whether you're just starting home care services or thinking about them for yourself or a loved one, this video will help you get a clear picture of what home care is really all about and why it plays such a vital role in healthcare today. So let's dive right in. Home care services are designed to provide medical and non-medical support to individuals right in the comfort of their own home. And when we say home, it doesn't always mean a traditional house. Home care can also take place in assisted living facilities or even independent living communities, but the key point is that it's a setting where the patient feels most comfortable. Now, one of the first things I like to clarify is that home care is not just for the elderly. Although many older adults benefit from home care services, patients of any age, whether recovering from surgery, managing chronic illnesses, or dealing with disabilities, can all benefit from receiving care at home. Let's start by talking about the medical aspect of home care. When we think about traditional healthcare settings, like hospitals or clinics, they provide a level of care that's focused on acute or emergency needs. But once a patient is stable enough to leave, they might still need ongoing care, and that's where home care steps in. Home care professionals, such as nurses, physical therapists, and aides, bring their own expertise to your doorstep. This could be anything from wound care, IV therapy, medication management, physical therapy, or even monitoring vital signs for those with chronic conditions like diabetes or heart disease. What makes home care so effective is that it's personalized. The care team is focused on your specific needs at your own pace and in a setting where you're most comfortable. There's also the benefit of continuity. You're often seeing the same team members over time, which helps to build trust and comfort. But home care isn't just about meeting physical health needs. It's also about emotional and social well-being. For many patients, being in a familiar environment can be incredibly reassuring, especially during times of illness or recovery. Home care providers often become more than just healthcare professionals. They become trusted companions. This is especially meaningful for patients who live alone or have limited social interactions. Regular visits from caregivers can help alleviate feelings of isolation, loneliness, and anxiety, which are all too common when someone is navigating health challenges. Another important aspect of home care is its role in promoting independence. Many people fear that accepting home care services mean they're giving up their autonomy, but in reality, Home care is about empowering individuals to maintain as much independence as possible while receiving the support they need. For instance, someone recovering from surgery might need help with mobility for a few weeks, but home care allows them to stay in their home environment where they feel in control. Or someone managing a chronic condition might need assistance with daily tasks like bathing or meal preparation, but they're still living in a space they call their own. The goal is always to help patients stay active in their daily routines while managing their health safely. In addition to supporting patients at home, home care plays a significant role in keeping the lines of communication open between patients and the larger healthcare system. Home care nurses and therapists are trained to notice early signs of complications or changes in a patient's condition. They're often the first to identify when something isn't quite right and can quickly communicate with your physician or specialist to adjust your care plan before a situation escalates. This proactive approach often prevents unnecessary hospitalizations or emergency room visits, which can be both stressful and costly. It also gives patients and families peace of mind knowing that someone is keeping a close eye on their health. Home care doesn't just support patients, it supports families and caregivers as well. When a loved one needs care, it can be overwhelming for the family members who are trying to juggle their own responsibilities. Home care services can ease this burden by providing professional, reliable help, allowing family members to focus on spending quality time with their loved one, rather than worrying about all the details of medical care or daily tasks. This support can make all the difference in reducing stress and caregiver burnout. Whether it's a few hours a day or around-the-clock care, home care can be tailored to meet the needs of the entire family. So as you can see, home care is about so much more than just medical tasks. It's about providing a holistic approach to care, addressing the physical, emotional, and social needs of the patient, all while offering peace of mind to their loved ones. It allows individuals to heal, manage their health, and live with dignity in a familiar environment. In the next segment of our video, I'll go into detail on what important information you'll need to gather and prepare for your first home care visit. Before your first home care visit, it's important to gather all the necessary information and documentation. This includes your medical history, your discharge papers, and your medication. Your medical history. This includes your past illnesses and any chronic conditions such as a recent lung infection or long-term diabetes. Family history like heart disease or cancer is also important, as is your social history like smoking, alcohol use, or other substances. Discharge papers. These are crucial in giving this information along with your current diagnosis or reason for hospitalization. The discharge summary contains vital information about your stay, including the reason for admission, treatments received, and follow-up care instructions. Medication list. The discharge papers contain a medication list and instructions. This is used by the RN to instruct and educate you on any changes or additions to your regimen. Sometimes instructions indicate stopping a medication and starting a new one, or adding new medications to your current list. Wound care, oxygen use, and special diet restrictions. If applicable, the discharge papers will have instructions on how to care for wounds, use oxygen, and any special restrictions. These papers are a guide for the nurse to plan your care. Also, make sure to show the actual medication bottles to the nurse so they can compare the information with the discharge paperwork to ensure you are taking the correct medications. Sometimes, the discharge paperwork only has information on your current hospitalization and new medications, so we must rely on you or a family member to paint a complete picture of your health. Ensure that your home care provider has your current address, phone number, and emergency contact information. I always try to confirm the address when I call the night before to set up my appointment because information changes and might not be updated in the chart. So please answer the unknown number. It's most likely your clinician trying to set up the visit. If there are special instructions for entering your building, such as a code or parking space details, let us know. We cannot visit unless you confirm that you are home. If you change your mind about receiving home care, it's during the confirmation phone call that you need to let us know. You have the right to refuse home care services, but it's best to let us know ahead of time rather than when we arrive at your home. Once you accept the visit, it is your responsibility to sign the consent forms and make yourself available for visits during regular business hours. You will need to agree to an assessment and care provision. You also agree to be responsible for payment based on your insurance, your copay, or out-of-pocket costs. By the time the clinician visits, the insurance company has typically already approved the visit and it is covered based on your policy. The home care agency will inform you about any payments needed, and you should always check with your insurance company about your policy. We also ask if you have advance directives. These legal documents allow individuals to specify their wishes for end-of-life medical care in case a patient becomes unable to communicate those decisions for themselves. There are several types of advance directives, such as living wills, medical power of attorney, and do not resuscitate orders. I will explore those in more detail in another episode. Remember, you are receiving home care because you are homebound, which means you are unable to leave your home without a great deal of effort or assistance. Medicare has specific criteria to determine homebound status and eligibility, which I will also explore in more detail in another episode. In this episode, we explore the vital role home care plays in supporting patients after hospitalization, managing chronic conditions, and maintaining independence, all from the comfort of home. Home care services can include nursing care, therapy, physical, occupational, and speech, and personal assistance. Before your first home care visit, it's important to gather key information: medical history, share your past illnesses, conditions, and family history. Discharge papers. These outline treatments, medications, and care instructions. Medication list. Show your nurse the actual medication bottles to ensure proper management. Accurate contact information. Make sure your home care provider has your current details and emergency contacts. Understanding your rights and responsibilities is also crucial. You can refuse services, but if you accept, you'll need to sign consent forms and be available during regular business hours. These forms also address your financial responsibility. Lastly, have your advance directives ready if applicable, and ensure you meet homebound status criteria for Medicare coverage. By preparing properly, you'll set yourself up for a smooth and effective first home care visit. That's all for today's episode. I hope this information helps you feel more prepared and less anxious about the process. Please stay tuned for our second installment of our 3-part series, How to Survive Your First Home Care Visit, where we will discuss preparing your home for the visit. Thank you for joining me today. I'm Carla Valentine, Nurse 411, and stay tuned for more upcoming CVN 411 episodes that will engage, enlighten, empower, and prepare viewers for all home care visits and understanding the process of home care services. Each episode will balance information with warmth and encouragement while keeping you engaged and informed throughout. If you found this information helpful, please leave a like, subscribe, share, and hit that lovely notification bell so you never miss an update. Also, if there are any topics you'd like me to cover, let me know in the comment section below. And please feel free to leave a comment, even if it's just to say hi. And always remember, the best wealth is great health. I'll see you next episode on Carla Valentine, Nurse 411. Until then, stay informed, stay safe, and stay healthy.